So thank you for this. This is our last seminar of the semester, and we are truly, truly grateful for our guest today. So we have Dr. Nandi Marshall, who all of you know is our Associate Dean for Academic Affairs in our college, as well as Ms. Christina Cook, who is a continuing second year, I think, doctoral student in our program. They have worked together for a bit, and they will be talking about the topic, as you have all seen, transparency, support, connection, the transcending the traditional mentor-mentee relationship. And I truly, as most of you, look forward to that. So welcome, Ms. Cook, Dr. Marshall. I will turn things over to you whenever you want to get started. You have the screen. And we truly look forward to hear what you have to share with us. And just a reminder to everyone, we will, if time permits, have a Q&A session afterwards. So please feel free to write your questions down and either put them in the chat or hold them and ask them of Ms. Cook and Dr. Marshall. So without further ado, I turn it over to Ms. Cook and Dr. Marshall. Thank you.
Good afternoon, everyone. I want to first make sure that on behalf of myself and Christina, that we thank Dr. Telfair and his office for inviting us to do this. We were really excited. Christina and I have had a mentor-mentee relationship for several years now, and we love what we do. And so we're happy to be able to share that with you all today. So quickly, we'll just talk about hitting points of what we'll discuss today. And so in today's DYAD, of course, we'll talk about our mentor-mentee relationship. We will absolutely talk about the work, so the things that we do, the deliverables, and we'll share some insight into what we're doing, and then our lessons learned. So I'm going to pass it over to Christina, who's going to start with her perspectives on why she chose me as a mentor and some other key pieces.
Yeah, and so like Dr. Marshall mentioned, we're going to go over not just our relationship and our work, but also the lessons learned from our relationship. And before I get into my viewpoint, I think it's important for everyone to know kind of how our relationship started. So it started before consolidation. So I was a master's student at the Armstrong campus, which was then Armstrong State University. And I was getting my master's before and during consolidation. And so I initially started as a graduate assistant for the entire college. If you go to the Armstrong campus, there are a couple of grad assistants who sit at the front desk. I was one of them. And it really formed because I grew up with a parent who taught me that it's very important to ask for things to do if you don't have anything to do. I grew up in a small business environment. And so I would go hound Dr. Marshall for things to do if she needed help with anything, her and other faculty members. And so over time, I think we just built a rapport of that. And she helped me not only navigate through my experiences in public health, but also help give me more access to her research and put me on her team. And so why Dr. Marshall? So again, like sitting at the front desk, it was not something that I really wanted to do. I thought it was very strange to just be there and answer questions when people come in. So I would go ask for things to do. And so over time, I wound up trusting Dr. Marshall more and more. I started learning more about health equity by working with her. And when I was applying for this program, I wanted more of her guidance because she was always in the college and we were always talking and working on things together. It made sense for me to seek her mentorship. And so from there, I remember when I was in my last year in the MPH program, she asked me for an entire list of all of my goals and things that I wanted to accomplish. So she has that and she taped it to her desk. And so every time I would see her, it would be on her desk. And we had, about the requesting regular meetings, we had a discussion about how often that should be. And so we would frequently touch base either every other week or at least monthly about where I am or any of the goals that I had mentioned. Am I really reaching those? Have they changed? Are there any additional ones? All of those things. And even now into the doctoral program, that conversation still happens. now it's more in terms of career, my research interests, and dissertation, which we'll get to a little later. And Dr. Marshall, you're muted.
It always happens at least once, so why not today? So as I was saying, some of the things that were really important to me as we began to build this relationship were the pieces that I have on this slide. So obviously open and honest communication. And I think that's clear really for any point when you're building a relationship, but I feel like it's crucial as you're mentoring someone, not just for me, but also for Christina, because I'm not perfect. And I also learned from her, as I'm sure many of you on here who have mentored others will know that it's a two-way street. You learn from the folks that you're mentoring just as much as they learn from you. Offering support beyond the work is important to me. I wanted to make sure that Christina knows I see her as a whole person and not just as a graduate assistant, not just someone who can assist me with a literature review or, that I can train on analysis or help write a manuscript, whatever it is. I want her to know that I see her as a person. So being able to support her outside of what we do together is extremely important to me. And I know that necessarily isn't included in all mentor-mentee relationships, but for us, it was really important for a number of reasons, many that I will not share on this Zoom. The accountability piece is important. I needed her to know that I will always hold her accountable, and I hope that she does the same for me. As far as that list that Christina discussed, that was a great way for me, one, to make sure that she's getting what she needs, but that I'm actually providing her resources and support in doing that as well. Again, prioritizing her needs is extremely important. I think often we can get lost in making sure that we're getting what we need as we're mentoring or working with someone who's helping us on our research, but it's not all about us. And so that's something that I had to make sure I was intentional about. Exploring past relationships. I've had some amazing mentors in my life. I've had some that were not so great. And so it was important for me as we built this and began to think back on the things that really helped me grow and the pieces that I really didn't like or didn't appreciate or they didn't serve me or my mentor well, so that I can include that. And then finally, enjoying the process. As Christina knows, as I'm sure many of you know, I just love life. And so for me, it's important to enjoy what I'm doing, to have fun along the way, and to find ways that she can be a part of that joy in my work.
And so we kind of touched it based on this already. So the mentor-mentee agreement that we have, we do regularly check in because we do so much of our work together. Sometimes it does blend in and we may not have like designated times, but if there is something specific that I really need guidance on, I will purposely go and schedule an appointment with Dr. Marshall. She's incredibly busy all the time. And so I'm very grateful that she is able to give me the time that she can. But I think it's very important, and I'm going to go back to something Dr. Marshall said, that even as a mentee, it's very important to see your mentor as a full person. And sometimes that may also be difficult. And when I think back on like, not necessarily mentors, but like bosses, like it's very difficult to like humanize someone who is in that role. So that goes both ways. So I also make sure that I see Dr. Marshall as a full person as well. And so we do regularly talk about our deliverables, and we'll get into that in a little bit because we do so much work together. There are a lot of different facets to what we do. And so we have regular meetings with other team members who are on those research projects with us, but also again, any meetings that we have related to her role as associate dean and any meetings that we specifically have about my plans as a mentee.
And then also, I think beyond the list, right? So as Christina and I have mentioned, there was this amazing list that we worked out when she was a master's student. And outside of that, there are still opportunities that I might say, here are some things that I want to support you on, or here are some things that you need to work on that I may notice that might, for instance, I'll give a great example. Making sure that Christina, as my graduate assistant, is only working 20 hours a week. Christina is also a very busy person, but I have to also hold her accountable to make sure she's not overdoing it, which can be difficult because even though I'm her mentor, she's also my graduate assistant. And so I need to make sure that she's also working on that work-life balance. I know that that might seem unheard of with her being a doctoral student, but as I tell students frequently, work-life balance is still important. You are still a person and you still have mind, body, and soul to be responsible for, whether you're a doctoral student or not. And so those are just some additional pieces as we talk about establishing sustaining relationship. So now we're going to get to the fun part, or maybe the busy part, or however you would like to view it. It's the work. I have been very fortunate to be able to have Christina work along with me all these years. I think the two of us share a lot of excitement when we've seen the growth of particular projects, particularly the work that we've been doing with REACH, and we'll talk about that in a minute. But it's been a very, very exciting journey. And so we're really happy to share some of the things that we have done. I will say, as she goes to the next slide, this does not include everything. So this is not an exhaustive list of all the things we've worked on. There are a couple of things that I intentionally did not include because they're still in progress and not ready to necessarily share. But these are the things that we thought were important to highlight, and some of the things we want to make sure we talked about how we work through these different items. So these are just an overview of the collaborations that we're going to talk about. Some research funded, some research that we were just interested in, other service, and then of course, Christina's next big task that we're very excited about her starting soon. So with our first collaboration, this one we actually worked on through Christina's MPH program when we started working on this one. There's a huge food insecurity issue, as you all know, and there's a lot more conversation around what's happening on college campuses. Christina has been very committed to really finding support in ways to increase resources and really get an idea of what's happening on campus. And so she came to myself and some other faculty about an idea that we could really survey our students in the College of Public Health to find out what's going on. And so our research team is listed, but it was myself, Dr. Nazareth, Christina, Dr. Jones, and Dr. Plaspel, who has since retired. But we did a survey really identifying what some of the potential issues could be if students are experiencing food insecurity and if it's having any effect. And so you can see some of the results here. Just to name the first one, 31.8% indicated they skipped a meal because they could not afford to buy food. And so, you know, for us as a university and seeing this, and this was just our college population, the College of Public Health, it concerned us because how can we make sure our students are supported? If a student is worried about how they're going to eat, they're definitely not worried about how they're going to take this exam. Like those basic needs need to be met. And so that was one of our collaborations, and we have a presentation coming up for GPHA that Dr. Nazareth is going to be leading. A second collaboration that we did on food insecurity was with a larger team. We were requested by the request of our dean to create a document on how the College of Public Health has the capacity to really address food insecurity in rural Georgia. And so Christina was a major part of that team as well. And I'll let her talk about the document a little bit.
Yeah, so like Dr. Marshall mentioned, we created a document detailing the food insecurity rates in rural Georgia, and we worked with Dr. Jones, Dr. Nazareth again, and also with Dr. Jiann-Ping, Dr. Apoku, Dr. Kimsey, and Mr. Owens. And so we were really looking at not just the rates, but what we could address within the rural Georgia area, specifically around Statesboro. And I want to just show you a couple of like what those deliverables look like. So on the left is the actual cover of our report that Dean Tedders has from us with all of the information that we got together, including some ways that food insecurity affects health, which is very important in our area, but also the work that we have been doing in food insecurity. I'll be submitting as a paper to Sophie, I think on June 30th. So that way we can get out the information.
So the next piece, excuse me, that I've been so fortunate to have her work with me on is our state opioid response grant. So for this grant, the state approached me, I think back in 2018, it was right after consolidation, to talk about ways that we could support their work in wanting to prevent opioid use among high school students. And so, well, high school and middle school students. And so they have an adopt a school program. And so they approached us about participating. And so, of course, I brought Christina in on that. And essentially what we've been doing is we started out with a behavior assessment survey. There's an evaluator that works with us. She created the tool, and the survey was dispersed first to the students, and then we use that data to create a social norming campaign. So for those who have never heard of a social norming campaign, essentially what that is we're promoting the positive pieces or promoting the data in a positive way versus focusing on the negative. So there's going to be an example on the next slide, but before we get there, I do want to recognize our team. We've had a really big team. I think one of the best parts about SOAR, and I'm not sure if Christina agrees or not, but one of the best parts is the amount of students that we've had working on this project and really exposing them to facets of program implementation and evaluation and research that they would not have had the other opportunities to do so. Our original group of students did this as a part of a class. Then we've had students do it for internship credit. And we're actually in the process of hiring 2 additional students for this summer. So if you know any undergraduate BSPH students who need an internship, please send them my way. And so the other piece that we've done before we get to the next slide is we've also provided a program for Georgia Southern students. We did it virtually last year. We'll be doing another one this fall. We haven't decided if it's going to be virtual or face-to-face yet. But one of the things that was really important to us, because we partnered with CAR for this grant, is to make sure that we're also providing something for the Georgia Southern University students and faculty and staff. And so that part has been really important for us. So I'm going to have Christina show some of our outcomes from this piece and specifically talk about what we've done with the social norming campaign, and you'll see some images.
Thank you so much. So these are some of the images. These are not exhaustive, and that's going to be with most of the things you see here. These are just the examples of what we've done. So on the very left-hand side, you'll see one of the screenshots of one of the pieces of social media content that we did give the high school. We have 5 or 6 of these that we did distribute to them so that they could use the images on Instagram and Twitter, which are their main accounts that they use. In the middle here on the left, I want to say thank you so much to Deborah for working on this for us and helping us get it distributed. This was a flyer that we distributed last year about Eagles Take Charge. So part of this program, we also worked on a Georgia Southern event so that we could work on opioid prevention efforts here as well. So this is just a flyer to show the actual event. And we also worked with student wellness and health promotion as one of our partners on that event. And to the right are 2 images from Woodville-Tompkins of the places where they've placed those messages. So they have, I can never remember what it's called, and I'm sure Dr. Marshall will help me out, one of the very large like backdrops that they move around the school where students can take photos and post them on their social media pages. And then on the left, one of the deliverables that we gave to them were bags. So at the beginning of the grant cycle and at the end, they would get bags full of items that were related to health in some way, but also had the messages on them. So on this photo, you see the message on a notebook and pen, and all of these items were something that the students requested from us that they would like to see more of. So the, go back to the last slide. So the item that she was speaking of is a step and repeat. That's yes, that's it. The other thing that I wanted to make sure I mentioned for that grant is that a part of our team, and it was listed on the slide, but I wanted to make sure I uplifted it, is a part of our overall team. We also worked with high school students, and that's been a really fun experience. For the kickoff of one of the grant cycles, our high school students made a TikTok and they talked about the survey, and it was really exciting, and they used a popular song at the time, but we thought it was really cool to really be a part of that. And they've obviously been instrumental on making sure that we're not just giving the students what we think they should have, but really giving us a perspective of what the high school students want, what they need, what encourages them, and so on and so forth. So that's been really awesome. And I do want to also specifically lift up the administration for Woodville-Tompkins and the Savannah Chatham County Public School System, because they have been awesome. They've been very supportive. And it's just been an overall great partnership thus far.
So the next one is Savannah Hope, which is probably my baby. I absolutely love working on this grant. This is part of the REACH grant. And so REACH is Racial and Ethnic Approaches to Community Health. It is funded through the Centers for Disease Control and Prevention. As a part of this grant, the leads for this grant are Healthy Savannah and YMCA of Coastal Georgia. And so I was contracted as a representative of Georgia Southern to lead the breastfeeding continuity of care work, which is a part of the nutrition piece. As you can see, there's a three-pronged approach that we took for this grant, and that includes nutrition, physical activity, and community linkages. Again, we've had amazing opportunities to include a number of students. We've had a lot of students complete their master's practicum and work on their doctoral practicum with us. Christina has been a constant from day one. And then we also partner with Healthy Savannah, of course, and just the overall Savannah and Chatham County community. For some of our activities for this grant, we've done quite a few things. So if anyone has ever heard me talk about our Photo Voice project, it's a part of this grant. And so as you can see on these pictures here, these are some of the photos from our Photo Voice project that were displayed at one of the locations at the health department. I believe it was at Chatham County Health Department in Savannah. And so our Photo Voice project, the real focus of that was to identify barriers to breastfeeding for Black and African-American women in Savannah and Chatham County. And so that data has really informed the work that we do. It was a great opportunity to hear from moms locally. Of course, we know what the literature says, we know what the data says, but it was important to get a local context so that as we're developing policies or as we're developing implementation activities, whatever it is, that we're making sure it's specific to the context in which we're working and not just what the literature says. One of the other pieces that we've been doing is our policy development and outreach. We've had some interns who are amazing. I think two of my favorite interns that I've ever had, Ariel and Jasmine. I think Ariel actually might be on here, but they created this amazing policy toolkit. And so Christina and I continually update it as needed, and we share it with partners. And that outreach has really been helping to increase the recognition of breastfeeding friendly organizations in Savannah and Chatham County. We're working on Georgia Southern becoming one of those as well. We're working on a lot of other pieces with the university, but just wanted to make sure I mentioned that because we're a part of Georgia Southern. Georgia Southern is a partner. So of course we want to make sure that we're participating as well. Everything that we're doing works towards increasing breastfeeding awareness in the county, and also working towards the family-friendly designation, which is that last piece. One of the other activities that we've been doing is supporting the baby-friendly hospital outreach. So there's a designation called baby-friendly that hospitals can attain by following certain criteria, and that really includes promoting breastfeeding and making sure that parents have that opportunity and support to do so, and that formula isn't pushed on them as soon as babies are born. If you've never had a baby, particularly if you've never had a baby at a hospital that isn't baby or baby friendly and promoting breastfeeding, they push formula the minute your child is born. And so one of the things that we've seen in the literature is that if you're supporting and not pushing formula, parents and lactating parents are more likely to initiate breastfeeding. And so that's really important. So part of our work is to support that outreach and let folks know about baby friendly and about breastfeeding. One of the other things that we're working on, which is the current work that we're doing, is we're working through the community readiness model. And so the community readiness model really focuses on any particular issue that you would like to look at and looking at the readiness level of that community. And so we're in the process of doing interviews. We're just about done. We'll be starting analysis over the summer. Once we've done the analysis, we're able to grade those interviews and provide a readiness score. Once we have that score, then we're able to work with the other data that we've received and the other interactions from this data, and to really determine what's the best next step in course. And so we can implement that into year 5 and also add it into future activities for sustainability. Christina is going to talk some about our other deliverables on the next slide. Oh, also, I guess I should mention this. Dr. Telfair would probably love for me to mention this. We have a manuscript under review. I'm very excited about that, specific to our Photo Voice project. We're really, really excited about that manuscript being under review. And then we've had multiple opportunities for presentations. Particularly, again, on our Photo Voice project, we have a presentation at GPHA next week. I was invited to speak at NACCHO Annual. We presented at Sophie, and then just as soon as last week, I was asked to be a plenary speaker on a panel for the United States Breastfeeding Committee. So I'm really excited about that. One other thing that I think has been a proud moment for both Christina and I is that all of the tools, documents, the Photo Voice project, the toolkit, the social media kit that Christina created for some of our faith partners are all being shared nationally through NACCHO and CDC. They really have loved what we were doing in Savannah and have been using us as an example. And so of course it's nice to be recognized, but that's not the point of what we do. The point of what we do is really trying to make a difference and hope that we can share those resources with other communities. So to know that the folks who are in charge really see a benefit, it means a lot because it means we're able to help other folks. And so it's been a great bridge to really make connections across the country that hopefully that we can have an impact to really change the outlook on breastfeeding.
And so I'm going to go over some of the other deliverables that we have with REACH, and because we have been working on this for a while, seeing it all together kind of feels overwhelming. So part of what we do is we also work with Shantae, who's on the REACH grant, and she does a lot of community outreach as well and a lot of peer support. She's an IBCLC in the area and works at Memorial. And so part of her efforts, you'll see on the left with this flyer, is that she offered a photo shoot for Black moms to help not only honor them, but also to help with normalization of breastfeeding. Just to the right of that, again, Ariel and Jasmine, if you're here as well, thank you so much for working on this toolkit. It has been an amazing tool to have to give to communities, but this is a photo of the very front of it. And so it's 5 or 6 pages long. It goes into the myths, the truths, how do you adopt it, what are the benefits, all of the contact information. It's all in that toolkit. And if you're interested in seeing like any of these items, I think except for the flyer, I can give you the link, and all of this is publicly available, like Dr. Marshall said. Just to the right of that, the What is Breastfeeding Equity image, we started making social media images, and I think I saw Erica on here just a moment ago, Erica Murray. She also helped with this toolkit. So we have a social media toolkit just about breastfeeding equity and the benefits to employers. And Diana and Momboy have been helping our 2 graduate students this semester are also helping with another one about expanding policy in terms of employee wellness instead of just it being another policy. And on the very right, I think is the thing that we share the most are the actual results. So it's the photo book. If you spent any time with any of us in the college, we usually have like it either in person or the link we usually share. And I will drop that link in the chat so you can take a look. But it has photos from the moms who participated, what they said, the barriers that were found, and some of the next steps that not only were found in the literature, but they suggested. That was one of the things that they did bring up, where these are the things that we actually want to see in the community in Savannah and Chatham County. And so the 2, I think, very interesting deliverables that we have after that are on the left is an actual proclamation from the city of Savannah, which is the first step in a breastfeeding family-friendly community. And so this was written, I think it was last year, and the 2nd of April, if you don't know, is Dr. Marshall's birthday. So the proclamation is for her birthday. So this is the very first step in the list of 10 steps. And so we have a proclamation written. And then on the right-hand side, Dr. Marshall was awarded the Health Innovation Award from Healthy Savannah last year for all of the work that has been going forward with breastfeeding equity.
So the next collaboration that I had to make sure I listed, because Christina has been instrumental in data collection for this piece. Here our team is myself, Dr. Telfair, Christina, and the Financial Aid Office at Georgia Southern. This is our Sds Grant. Many of you are probably aware of this grant. Essentially what we're doing is funding graduate education, which has been a great joy of mine. You know, academic affairs means a lot to me. And so having the opportunity to provide funding for students to come to school is it's just amazing, and so overjoyed that we're able to continue this relationship with HRSA. As a part of this grant, though, there's a lot of data that we need to report on annually, and Christina has created a tool and collects data and helps to get all of this information sent to HRSA, which is no small task. And so we could not do this presentation without including this piece. So even though it's not traditional research, she is working with some data and making sure that we're staying in compliance so that we can receive funding in years to come. So thank you, Christina. The next one. Okay, so one of the things that I learned early on in my education and in my career, a mentor that I had and still have, Lynn Woodhouse, who actually happened to be one of our previous associate deans for academic affairs. So talk about full circle. She always included me in not only her research, but also her service. So for me, when Christina and I talked about ways that I can support her in her growth in public health, it was really important to me that I also shared service opportunities with her. And so I was the chair for Georgia Sophie's education and training, and we were looking for a co-chair. And so I approached Christina and said, would you be interested in doing this? No pressure. And so I told her more about the position. She talked with the president and she ended up joining the board. And so it was a really great opportunity, very stressful, a lot of work, but it was worth it. The real purpose of what we were doing was to create and offer continuing education opportunities for health educators across the state of Georgia. And so as a part of that, we served on the board of directors. Of course, we assisted with the annual report for the chapter, and we were co-chair of Georgia Sophie's Continuing Education Committee. And Christina's going to talk about two of the deliverables that we had. One of them was a very large task. We were so happy when we finally saw it through, but it was a great program, and I'm really excited to hear her talk more about what we did.
So like Dr. Marshall mentioned, part of our task on the board was to create educational opportunities for other Georgia Sophie members. And so there were two. The large task that she was speaking of was the virtual mini summit. So we worked with some of the other board members and other members to create this. So we had 3 speakers. We initially talked about it being, I think, a full day, and then we shortened it down some. But you can see a flyer of it on the right. There were a few other parts with a student panel in there, as well as a wellness section, which isn't featured on here, where Tamara, the president, asked one of her friends to lead a chair yoga session as part of the wellness break. And on the left-hand side, we worked with GCAP, which I can never remember the full name, about addressing or leading a session on trauma-informed education. And so we offered this for CHES credits towards the end of the year for any of our members. So it was just a very short 12-to-1 session and covered ways that health educators can use trauma information and education in their classrooms to help make more inclusive spaces for LGBTQIA+ students.
So the next collaboration, Christina has been an awesome graduate assistant. I'm sure many of you have heard me brag about her before. I honestly do not think that I could get through the day without having such a great graduate assistant. And so that does not fall short in academic affairs either. Christina listens to all of my crazy ideas that I have for academic affairs, and she helps me see them through. She created this image, and many of you have seen it already, our 2022, the year of review, which has been a great year so far as we prepare for our self-study for CEF accreditation and reaccreditation. And so she's been instrumental in a lot of the things that I've worked on. She's volunteered to serve on various committees within academic affairs, for example, the Recruitment and Retention Creation Plan Committee. And she's just been an awesome asset to academic affairs. So I wanted to make sure we included this so that I could publicly thank her for that, because, you know, her graduate assistantship, the focus for her in my mind is that I really want to help her grow and be amazing in research as she already is. But you know, we still have to take care of academic affairs. So she's always up to the task whenever I'm in need of assistance and really helps out. And again, thank you, Christina. I don't know if I can say thank you enough, and I want to make sure that I'm publicly doing that so that you truly understand how instrumental you are to the work that I do for Georgia Southern.
And thank you, Dr. Marshall. Like, this is a big reason why I love working with you, is that you are very, you're also very student focused, and it's been a real pleasure working with you. And I can't wait to see like where everything else goes. And so I wanted to touch briefly on why I'm choosing, or I've already chosen Dr. Marshall as my dissertation chair, and luckily she said yes. And so it wasn't specifically because she was my mentor, it's because we have a very long standing rapport. She knows where all of my strengths are, where all of my weaknesses are, and I trust that she's going to push me in all the ways that I need to be pushed. So if you haven't made a decision on a dissertation chair, know that you don't have to specifically pick your mentor. I chose her for those reasons, because I know that she knows exactly how to get me to where I want to go. And a lot of her work in health equity, which I really appreciate, is if we're not doing what we're saying we're doing, then I think it's very important that we need to address it. And so I'm not really going to touch much on my dissertation topic, but a lot of it deals with specifically that, like, what are we dealing with health equity? What do we really mean? And so it was very important for me to find someone who not only works in health equity, but understands that that's an ever evolving lens, and that we really need to involve the communities that we want to work with if we do mean health equity. And so we're going to go into lessons learned. I think I'm first. I am. And so for me, a lot of this I've already mentioned, mostly keeping her up to date. I'm someone who has a lot of interests, and I think too much. I overthink a lot of things. And so that always changes, and I'm always learning to, or I'm always finding other things that I want to do or explore. And so for me, one of the things that I've learned is that I need to make sure she stays up to date on that. I can't receive mentoring if she doesn't know that all of a sudden this isn't something that I wanted to learn. And I mentioned also here having different capacities. One of the things that I've had to learn kind of the hard way, and like we joke around, is that I have like this really difficult time saying no. But while I have like a very ambitious output, it's something I've learned is that I burn out very quickly. And that happens especially with, you've seen how much work we do together. We do a lot of work together. And so sometimes like being able to communicate that is part of my lesson learned in the experience. And so again, a lot of the lessons that have been for me have been more about being more open about the communication of what's going on. What are the things that I'm working towards? Are there any problems that I'm having? And just meeting with her regularly. Again, like I am always thinking about things. And so a lot of times, like my brain is always like, well, what if we do this? What are our new goals? And so just making sure that she knows that. And one of the other things that I learned was, again, like one of the reasons why I picked her or asked her to be my dissertation chair, is that we do have some of the places where our interests intersect. We do have this commitment to health equity. And any time that I bring something up to her that may not necessarily be in her wheelhouse, she has been very good. And I absolutely love her for this, for getting me to the person I need to. So when I was focusing more of my dissertation being on food insecurity and migrant farm workers, so she like immediately emailed somebody, got me into contact with them, and then they gave me an entire list of people who I needed to talk to. So she has been incredibly wonderful with all of that. And I'm gonna turn it over to her now.
Wow, Christine, I'm going to try not to cry as I finish this slide, but thank you. It's much appreciated. I think for overall as the experience, I will say it's really been a great joy. If you haven't heard that already, that it's been a great joy working with Christina and mentoring Christina. For me, mentoring is key. Regardless of what I'm doing, working with students is very important to me. No matter how my roles have changed at Georgia Southern, that has always been important. That if I can't mentor students, I don't want any part of it. So having the opportunity to mentor Christina and work with her all of these years has really been a great joy of my life. My family knows Christina's name. My sister works with Christina now. We have some projects that we're working on with my sister. We've involved her in some things that we wouldn't necessarily involve everyone. And so it's been really great to have that connection with her and to really be with her along her journey. Some of these pieces I've mentioned, like obviously communication, that was a lesson that was not only learned, it wasn't necessarily learned. I knew that we had to have open and honest, but it was more reinforced throughout this process. One thing that I think was very important, a major lesson for me, is balance, right? So balance in not just workload, but also in relationship. It's really important to kind of have boundaries. And I think that's been difficult for Christina and I. We are alike in so many ways that if we were not at Georgia Southern and we met somewhere else, we probably would be really good friends. And it's not that we can't have a friend relationship, but it's hard to balance the friend, the mentor, the supervisor, and all of those things. And so I think that's probably been the toughest part for us to navigate, but we found a way to make it work, which is great because that can be really hard if you cannot figure out how to make it work. But then also that workload piece. So remember, we're all whole humans, right? Georgia Southern is not the only thing that exists in our lives. My job being her supervisor, the research that we do, her being in dissertation or almost in dissertation stage, but being a doctoral student, balance is key. Work-life balance is key. And so making sure that I'm holding Christina accountable, saying, hey, when you hit those 20 hours, put it down. I don't care what it is. If it's something that's urgent, tell me, Dr. Marshall, I didn't have a chance to finish it this week because I ran out of time. I will take care of it. So those things are really important that I make sure that I'm establishing and maintaining and navigating through. So I think to me, again, the balance is something that I've learned how to work through over the years that didn't necessarily come as easy as the communication part. And then finally, patience, right? That's also a part of, again, remembering that I'm human and that Christina is human. And I must say that I'm thankful that she also has patience with me. Christina knows how busy my schedule is. And she's found a way to, one, keep me on my toes to make sure, like every now and again, she'll even send me an email. Don't forget to do this. She'll schedule emails to make sure I don't forget to do something. And that's been very helpful. She doesn't have to do that, but it's been a great bonus in our relationship that she's really helped me to stay on my toes. And then me also remembering that, you know, Christina is amazing. Christina has things that she still wants to learn. Christina is still developing. I'm still developing. And so making sure that I remember, okay, this is something we're working through. We have time to get it done. Let's be patient. You're not the only thing in Christina's life. That's something that I have to remember. Christina's life is not devoted to me. And as unfortunate as it is, no, I'm just playing, but I do have to remember that whether, even though she's a graduate assistant, even though we have all this work together, I am not the only thing in her life, and I have to remember that. And so that's also been helpful to navigate. And it's also helpful to remember as you're navigating your mentor and mentee relationships that, again, we are whole. We're not just one thing. We're not just what you see. There are a lot of different pieces that we have to consider as we move through. And so, thank you. I had a great time, and I can see from Christina's face that she did too. Again, we're very thankful that we had the opportunity to present and be the last DYAD for this academic year. And we're happy to answer any questions that might be out there.
Well, that was excellent, among other things, but also very, I would say more than excellence. It was, I think the other term to use was close to the heart, you know, because what y'all presented is, we all, not only is it like we all can learn from that, but we all can truly, truly appreciate the relationship, and that both the, you know, outstanding promises, but really the challenges, you know, of keeping this up on this, keeping it in the way that y'all have sort of maintained over these years. I mean, that's a real testament. So I'm truly appreciative that you all decided to do this. So having said that, I would like to open it up. If people unmute yourself, because I don't see any questions in the chat, but for any comments or any expressions or whatever it is you want to have at this point, we have a good 10 minutes to go, so please feel free.
I don't have any questions, but I did work with Dr. Marshall on the toolkit and, you know, helped you with the photo voice a little bit. And I just, just sit here and smile. Like, I love how much you guys have done and like grown and, you know, kept it going. I really love it. I've been texting Jazz, like, it's so big, like, and she's just like, I could cry. So like, I love this. It's like, I had a smile throughout the whole presentation. I like what you guys are doing. It was a great presentation.
Thank you, Ariel. You know, we miss working with you. Y'all were awesome and a great way to kick off how we involve students in this project. I think y'all set a really high bar. So just know how much you all are appreciated as well.
I appreciate that. You guys really make me miss community health. Now I'm in health policy, but I miss you guys.
Hello, this is Tareya. I've had the pleasure of working with Christina and Dr. Marshall, and you guys are both great, and I love seeing you guys dynamic. I too was smiling the whole time. A question that I wanted to know, I know you guys talked a lot about like the dynamic, the relationship, and like you guys' growth and things that like the expectations and boundaries you all had to set. So I was just curious to know, what did you guys learn from each other personally, not regarding work, that you guys like? Christina, what did you learn about yourself from Dr. Marshall? Dr. Marshall, what did you learn from Christina about yourself that's not related to work, something personally growth wise?
I can go first, Christina, unless you want to go first. No, okay. I'm happy to go first. So I think one thing for me, and this is me being as transparent as I can in this environment, I think Christina has reminded me to be true to who I am. I think a lot of us throughout our lives struggle with that, you know, particularly if, you know, you feel like you have to be one way at work, one way outside of work. And for me, I think within all that, Christina reminds me constantly, just by the way that she is and who she is and how she communicates with me, is just to remember who you are and to make sure that you're showing up as yourself no matter what you're doing. And I tell students to do that too, but I think sometimes I need to remember that for myself. And Christina has really helped me do that and really reinforce that it's okay for me to be myself. And so I think that was a major lesson for me.
I don't appreciate your question because it's going to make me cry. And your response is going to make me cry. But I think the biggest lesson that I've learned from Dr. Marshall is, I am going to run out crying, to be nice to myself. So if you know me, I'm incredibly hard on myself all the time. And so with her, that's one of the things that she's helped me see, is that it's okay for me to give myself grace and to be nice to myself. And that it's okay for me to have maybe not astronomically high standards and to like really push myself, but it's okay then if I don't meet those, and to remember that it's okay for me to essentially be nice to myself.
Thank you guys for your answers. That was beautiful.
Thank you. So Ms. Honda E. Jules, you had a comment?
Yes, I just wanted to, I said it in the chat, but this was so refreshing to see this dynamic between you two. It's really great when the mentor relationship buds into something that's far deeper than that. And I love how both interests from both sides have been able to be incorporated throughout this whole process. And I'm so looking forward to see this dynamic expanding post Christina graduating and becoming a doctor, and seeing how you all continue to do the work in the future. And thank you for sharing this, because this is just an amazing space to share the beautiful bond that you guys have. And thank you, especially during, you know, the last week before classes and before finals. So thank you.
Thank you, Tanya.
Okay. Any other comments? You've gotten a lot of claps, and I'm not sure what Dr. Messenbank brings. Some had a symbol. I don't know the emoji, so I can't even figure out what that emoji was. But anyway, I'm guessing that it was like happy or some type. So
I think it was the crying emoji.
It was a crying emoji. Is that what it was?
I think it was. I think it was.
Okay, it flashed so quickly. Sorry about that. All right. Hey, so be it. Okay, any other comments? So I just want to thank you both again for such a phenomenal presentation, and echo what Ms. Tanji Jewell said about, just that this is a really good way to end the semester, and to listen to you all. And so shifting a little bit, so thank you both. We are truly grateful. We will start our seminar sessions back up in the fall. And as always, we're open to suggestions from folks to, of bringing people on board, both here at Georgia Southern, outside of Georgia Southern. And we hope that you all have enjoyed and learned and grown a bit from what we presented so far, and also from what was presented in the B seminar, which I think there's one more left or so on that end. So thank you all again. I'll give you all back the 5 more minutes for the rest of your day, and please keep in touch and let us know what you think. Please also remember that this presentation plus the slides will be posted, as well as the recording of it will be posted as well. So thank you all again. Have a good rest of the week. And for y'all who have last class and finals, you all have, as you know, you have our best. Okay, any closing comments from Ms. Cook or Dr. Marshall?
My only closing comment is sending you all success and happiness during this last week and as we go into finals. And for those who are preparing to study for comps, you've got it. You will be just fine, and you will get through it. And we're here to help you if you have questions up until then. That's it.
Yeah, and I just want to echo the same thing, but we talked about this multiple times, but it is very hard, especially as a doctoral student, a graduate student. Remember that you are human and take some time for yourself between all of this. So it's okay to rest. It's okay to do all those things. Just take time for yourself and get through it. But we're almost there and we're almost done.
Okay. Thank you all. Take care.